Critical connection between sleep and eye health. Sleep is essential for our bodies and minds, including our eyes. Our eyes need sleep to repair and rejuvenate. During sleep, they clear out waste and replenish nutrients. Tears produced during sleep keep our eyes moist and healthy. Adequate sleep ensures our eyes function at their best. Short-term sleep deprivation and your eyes. We've all experienced that gritty feeling after a poor night's sleep. Our eyes feel dry and itchy. They may even appear bloodshot. These are some of the short-term effects of sleep deprivation on our eyes. Our eyes need a consistent sleep schedule to function correctly. Lack of sleep can also cause our eyelids to twitch uncontrollably. This twitching, known as myokemia, can be distracting and annoying. In some cases, it can even interfere with our vision. Another common side effect of sleep deprivation is blurred vision. When we're tired, our eyes have difficulty focusing. This can make it difficult to read, work on a computer, or even drive safely. Long-term consequences of insufficient sleep for eye health. Chronic sleep deprivation can lead to serious eye conditions. These include glaucoma, dry eye syndrome, and age-related macular degeneration. Glaucoma damages the optic nerve, leading to potential blindness. Dry eye syndrome causes irritation and blurred vision. AMD affects central vision, crucial for reading and recognizing faces. Sleep apnea, a disorder that disrupts breathing during sleep, also poses risks to eye health. People with sleep apnea experience pauses in breathing throughout the night. These pauses can last for several seconds and occur multiple times every hour. This disrupts the flow of oxygen to the body, including the eyes. Studies have shown that sleep apnea can increase the risk of developing glaucoma, especially a type called normal tension glaucoma. This type of glaucoma can damage the optic nerve even with normal eye pressure. The link between sleep apnea and eye problems is thought to be due to several factors. These include fluctuations in oxygen levels, changes in blood flow to the eye, and inflammation. Many eye problems are preventable with simple lifestyle changes. Prioritize sleep for optimal eye health. Aim for 7 to 8 hours of quality sleep each night. Establish a regular sleep schedule. Create a relaxing bedtime routine. Ensure your bedroom is dark, quiet, and cool. Avoid screens before bed to reduce blue light exposure.